Now, today we'll be discussing about the venogram. Now, venogram is purely done to see whether there is any venous sinus thrombosis or cortical venous sinus thrombosis. Most of the time, patients present with definite history of headache, which is extremely common, which is usually followed by convulsions or altered mental status. This is very typically especially seen in young patients, especially those patients who are purely vegetarian, because they very commonly have vitamin B12 deficiency, hyperhomocystinemia, or the patients may have hypercoagulable state. So in this, what we see, this particular patient was having right temporoparietal venous infarct, and the venogram was done. So this was the venogram of that particular patient who had VST, and this is a normal venogram where there is no actually block or thrombosis in the particular venous sinus. Venous sinus. So when we see uh, for normal structures, or what I'll be telling in this particular venogram is the midline largest sinus is all superior sagittal sinus. This is all superior sagittal sinus that we can see in the midline. This is the superior sagittal sinus. And this superior sagittal sinus, this is the confluence because these two sinuses meet here. So this is called uh, confluence of this sinus. And this in confluence, the next thing is from this confluence arise two transverse sinuses because this is transversely placed. So this is transverse sinus. And this transverse venous sinus is carried or is continued as a S-shaped sinus, which we can see. This is S-shaped sinus. This is S-shaped sinus, which we call it as sigmoid sinus because it is a shape of S or sigmoid shape. And then this sigmoid sinus continues as IJV, that is internal jugular vein sinus or internal jugular vein. So in short, in this, we can very nicely make out the superior sagittal sinus, the confluence, the both transverse sinuses, sigmoid sinuses, and IJV. It is very crystal clearly we can make out that this is transverse, this is sigmoid, and this is IJV. This is IJV, this is sigmoid, and this is transverse sinus. And on both left and right side, we can see it very crystal clearly. But what has happened here? If we try to find out in this venogram, we can definitely see the superior sagittal sinus, which is in the midline. We can see the left-sided transverse, left-sided sigmoid, and left-sided IJV. But where is the right-sided sinus? The right-sided transverse sinus was supposed to be here. The right-sided sigmoid was supposed to be around here, and the IJV was supposed to be here, but it is completely not visible. Here also you can make out the same thing. So this is in short, the first and most important thing is whenever we do venogram, we doesn't do only venogram. We always do MRI brain also with this, and we also carry out venogram with that whenever we suspect venous sinus thrombosis. And when we suspect venous sinus thrombosis, is any young patient especially, or any patient who is presenting with headache or convulsion or with altered mental status. And in most of the time, CT scan will definitely show some infarct, and patient may also show hemorrhagic bleed. And when we do this venogram, at the same time with venogram, we always do MRI brain, so it will definitely show a infarct or hemorrhagic infarct. So whenever there is infarct or hemorrhagic infarct, along with such type of abnormal sinus thrombosis, then it definitely confirms that there is this venous sinus thrombosis. Uh, there can be many of the times the sinus can be very thin, what we call it as aplastic or hypoplastic sinus or venous sinus. Most of the time, if this is this much thick, what you'll get is very thin sinus. That we call it as a hypoplastic venous sinus. But that time, you will not be having any infarct. So patient will not show any infarct. So whenever there is infarct and there is absence of this type of venous sinus, then it simply confirms that there is particular cortical venous sinus thrombosis. So thank you.